Let's document. Join me as we cover breast ultrasound protocols on today's edition, Documenting Skin Invasion. Let's talk about how to document skin invasion. And this is when your mass has invaded the skin layer. And clinically, the skin is going to have a dimpling or pitting appearance, like an orange peel, the putty orange skin appearance. You may see a discoloration of the skin, redness, purplish. Sometimes it can even look like a bruise, possibly a rash, possibly some ulcerations, retraction of the skin. All those are features that there might be some sort of skin involvement. On ultrasound, you're going to see skin thickening. The AP dimension, the anterior posterior dimension, or the height as it's known, which is going to be a vertical measurement, is going to be greater than 2 millimeters. You'll often see these multiple wispy hypoechoic spiculations of the tumor extending into and through the skin layer. This mass is going to be irregularly shaped. Irregular margins, microlobulations, spiculations, angular margins. Most commonly, it's going to have a vertical orientation. You're going to visualize hypervascularity, and it's most of the time going to be markedly hypoechoic. How we document skin invasion is you want to ensure that you measure the skin thickness. You also want to decrease your depth and or zoom the image up so that you are clearly demonstrating the relationship of the mass to the skin line. You want to be sure to use color Doppler in 2 imaging planes. And then it's important to either use a standoff pad or a glob of ultrasound gel if the skin line is not well visualized. Time to summarize. Here's the protocol for documenting skin invasion. You want a radial image with and without measurements of your mass, a radial image with color Doppler, an anti-radial image with and without measurements, an anti-radial image with color Doppler. It doesn't matter what planes you take your measurements in as long as you've covered all 3 measurements: your length, which is a horizontal measurement, your height, which is a vertical measurement, and your width, which is a horizontal measurement. If the mass has extensions to the skin, you want to document images of the mass clearly demonstrating the relationship between the skin and the mass in both planes. And you do this by decreasing your depth and zooming the image up so that you can clearly see the mass in relation to the skin. You want to measure your skin thickness. This is your AP, anterior posterior dimension, also known as the height. And a color Doppler image should be documented showing the mass and the skin. Also, use a standoff pad or a glob of gel if you're not well visualizing the skin line. Interested in more videos on ultrasound? Don't forget to like, comment, and subscribe, and tune in for our next video on Wednesdays.